An HRT is just a blanket statement that covers a variety of different compounds that we've got as physicians in our medical toolbox. So just to clarify, for the most part, HRT is referring to some form of estrogen and progesterone. And then depending on the provider you're working with, you might also be recommended to take testosterone. And then deeper dive, some people may even include DHEA and pregnenolone as part of their HRT package. It really just depends on the provider and the level of education they've had and their specific area of interest. Now that HRT can then be further subdivided into this idea of bioidentical and synthetic forms. Now in 2025, I feel pretty comfortable to say that most of the HRT that's being recommended is bioidentical. So if a woman's going to her doctor and says to her physician, I'd like to be on bioidentical hormones, and her doctor says, oh, I don't do that, she can rest assured that usually that means her doctor doesn't quite understand what that term means. So bioidentical means that it's an identical match to the hormones that your body once produced. And for estrogen, we have that available as estrogen gel, as estrogen patches, and as tablets that you can take, and then also in the pellets that go underneath the skin. Progesterone also exists in a bioidentical form, and commonly it goes by the trade name of Prometrium. It's generic as well, or it can be compounded, but micronized progesterone is that bioidentical form. Years ago, when HRT was not as commonly prescribed and bioidentical hormones sort of came up in the late 90s, early 2000s as the thing to do, as deemed somewhat to be safer. At that time, we were still prescribing more of those synthetic hormones or hormones from other sources that are not human identical, such as Premarin, for example, which is an older form of estrogen replacement, or that synthetic Provera, which is a progestin, or I would say progesterone-like compound. But those aren't commonly prescribed anymore. So that idea of bioidentical hormones got mixed up into the whole idea that, oh, these are somehow compounded or somehow not real medicine, but that's not true. Does that help?
Yeah. So, but when you say bioidentical, is it identical to each woman as their bio makeup, or?
Yeah, that's a very good question. So typically the word bioidentical means the hormone itself, what you're picking out from your pharmacy, molecules in that compound look the same as what your ovary would have produced. But where we can take it one step further is really more individualizing the dosing for patients. And that comes with expertise and experience. So some newer doctors or doctors who are just starting to prescribe HRT now, and they haven't been comfortable doing it all their career, and they're just bringing it in, they're probably not going to be individualizing dosing. They'll be using very standard, this is the what's available. But in my practice, I do try to do that for my patients because we're not all built the same. So part of the process is figuring out exactly what Kamisha needs, or exactly what Denise needs, or what Christine needs, so that she can feel her best.
Now, I wanted to ask, are there any potential risks with some of these hormone replacement therapies? Some of if you mentioned estrogen gels and patches and things, are there things that women should be concerned about when taking them?
Starting with synthetics, it's particular too, because a lot of doctors are not familiar with bioidentical, and they won't tell the patient. They'll just prescribe them the synthetic,
Right. Okay. So carrying on that line, before I answer the question, there are some other hormone replacement options that I would say still fall under that synthetic category, like they're called selective estrogen receptor modulators, which is a big long name, or SERMs for short. That goes under the trade name of Duaviv. And there's also the birth control pill, which is very commonly prescribed because doctors are comfortable with the birth control pill. They use it to manage dysfunctional bleeding, or they certainly use it for contraception, or in teenagers, they're prescribing it for acne. So a lot of general doctors are comfortable with the pill, and they might recommend that in lieu of HRT just because they're more familiar with it.